What is a pharmacy buyer? Are you looking for information, motivation, or inspiration? I'm Morgan, and welcome to my channel. A pharmacy buyer. A buyer is a person who buys drugs. A buyer is a person who buys drugs and supplies for the pharmacy, for a healthcare center, kind of like a hospital. Sometimes that's a retail pharmacy. Let's talk about a little bit of things that a pharmacy buyer actually does on a day-to-day basis. One of the first things is inventory. So when a buyer purchases drugs, not only do they buy them, but they take full control of these products by managing inventory, making sure things are on the shelf in a timely fashion, making sure things are taken off the shelf when it's not in use, making sure that things actually move very smoothly from the point of purchase all the way down to the point of where it's utilized or returned. Another thing that a buyer does is handle drug shortages. Situations in our community or in the environment that happens that can affect the availability of certain drugs. And so what a pharmacy buyer's job is to do is to maintain those shortages, make sure that nothing completely runs out, and if something is getting short, that they communicate effectively to make sure that there's other alternatives for patients to be able to use. Another thing that a pharmacy buyer does is managing contracts. Just like a buyer does in other industries, a pharmacy buyer also handles contracts. So those contracts can help to save money, so that they can save money for patients or end users or for the hospital. One of the other things that a pharmacy buyer does is maintain formulary compliance. So a lot of times facilities will mandate which drugs they want to keep on hand, making sure they're not keeping too many drugs that do the same thing. That is what a formulary is for, and it is a buyer's role to make sure that they are compliant with what the facility or the organization would like to stay within the confines of. The biggest thing that a pharmacy buyer will do in their role is to maintain budget. Hospitals specifically, 60% of their budget is in the pharmacy. So it is the pharmacy buyer's job to manage that budget and to keep everything within the cost confines. If you're a pharmacy buyer at a hospital, you have a huge role in managing that budget. There's a lot of finance work that goes into that as well. That is all I have for you. For more information on pharmacy buyers and all things pharmacy, give me a like, subscribe to this channel, and I have a lot more coming for you if you're interested. Thank you. Bye.